Good morning. My name is Martin Forster. I am with RemX. Healthy patients, healthy practice. I have the privilege this morning of introducing our sponsor. Our sponsor this morning is RemX, who are the nation's largest medical specialty staffing agency. And I'm going to be introducing their area manager. She is the market manager for this region. Her name is Karen Stanton. She's been with the company 17 years, and during the course of that has helped develop this company into the primary staffing agency for Florida Hospital. And I also have to give her my deepest sympathies. She is in fact married to an Englishman. Karen, you're right there. Okay. Please help me welcome Karen Stanton.
As noted, I'm Karen Stanton, Market Manager for RemX Specialty Staffing, and we're so very pleased and so proud to be the corporate sponsor for today's events, and glad to see everybody getting up early and arriving here and enjoying the lovely breakfast. And our hope today is that anyone in need walks away with some good workable coping strategies on helping physicians deal with stress and burnout, and we look forward to hearing today's presentation. Know that we do our part as well to help physicians deal with stress and to deal with burnout. And the way that we do that is we provide quality and qualified clinical and non-clinical staff to help alleviate the pain, if you will, of the shortages that they're feeling in a competitive talent market of today. So we hope that when you go to field, or if you indeed are a physician, that you remember RemX when the time comes to address any staffing needs in your offices or with the clients that you all serve. But when I thought about today's presentation in the last couple minutes that I have left here with you before we turn it over to our speaker, today is really not about RemX. We were fortunate enough to be a corporate sponsor, but today is about the physicians, isn't it? And helping them to get the very important work that they do get done every day. It's about how much we value these doctors and the commitment and the sacrifices that we know that they all make every single day. So, I figured to acknowledge them and to recognize the contributions that they make, that I would leave you, rather than a spiel about RemX, because you're welcome to see our spiel and take our tchotchkes home with you. And I'm sure that Kitty does a great job of educating everyone every day and at every opportunity on what we do. But rather than to go through that, to leave you with a poem that helps us to remember why we're a part of this group, which is to serve the physicians in our community. And the poem is called The Good Doctor. The dictionary defines a doctor as one trained in the art of healing, but that simple, brief description is not especially revealing. For good doctors have virtues that cannot be measured by a test, certain special qualities which they have been blessed, such as how to really listen, how to calm an anxious mind, being objective, being direct, but also patient and kind. And guided daily by the oath they swore to observe, they treat all those in their care with the respect that they deserve. Good doctors are confident, they believe in their ability, but they never lose sight of the importance of humility. For they know that they're not perfect and their effectiveness depends on their awareness that as doctors, learning never ends. Doctors make sacrifices, and many times indeed, they set aside their personal lives when a patient is in need. Most of all they know, it's not the things that they possess, but rather how they cared for others. That's the gauge of their success. So to the physicians in the room and those who serve the physicians, we thank you, and we hope that you enjoy today's presentation.
Thank you, Karen.